Welcome, dear students. The program that I will be dealing with is Bachelor's of Arts, third year. Subject is Psychology. Semester is 5th. Paper code is PSC 105. Paper title, Understanding Psychological Disorders. The title of the unit, Unit 1, Overview of Abnormal Behavior. Module name, Epidemiology, Prevalence, Incidence, Co-morbidity and Treatment. Module number 8. I am Aldina Braganza, Associate Professor, Carmel College of Arts, Science and Commerce for Women, Nouvelle Goa. The outline of my lecture and unit is I will be looking at epidemiology, in which includes prevalence, incidence and comorbidity. And the next part I will be looking at is treatment and looking at mental health professionals. The learning outcomes of my unit is to comprehend epidemiology, prevalence, incidence and comorbidity of mental illness, to explain why people seek help for mental illness, to understand treatment, to discern the various mental health professionals involved in treatment. Epidemiology. Epidemiology is the study of the distribution of disease, disorders or health-related behaviors in a given population. It gives an overview of mental health in any country, state and across the world. Epidemiology studies are important because it helps us understand causes of mental illness, the triggers that could be prevalent in a given society, and it helps with the treatment. The key component of epidemiology is these surveys determine the frequency of mental disorders. Epidemiology includes prevalence and it gives us the incidence. When we conduct studies, studies reveal that, for example, a study that was conducted in India in 2017 by Patel and al. And is reported in the Lancet journal, the references of which, the links of which I have given in our references. The studies report prevalence rates for psychiatric disorders in India. Of the population that was surveyed, 197.3 million people had mental disorders in India, of which 45.7 million were depressive disorders and 44.9 million were anxiety disorders. This survey immediately brings to attention two major disorders in India, that is depression and anxiety, and therefore this research helps understand what could be the reasons behind such kind of disorders increase in numbers. The prevalence of mental illness basically deals with the number of active cases in a population during any given time. It is expressed at percentages. The methods of prevalence estimates, they look at 1-year prevalence versus lifetime prevalence. For example, in the same study, excluding tobacco use disorders, mental morbidity of individuals above the age of 18 years was currently about 10.6%. The lifetime prevalence in the surveyed population of mental illness was about 13.7%. Incidence. Incidence is another kind of data that we get from epidemiology studies. It tells us the number of new cases that occur in a given period of time in 1 year in a population. Incidence cases will be typically lower than prevalence cases. For example, in the same study, 1 in 7 Indians were affected by mental disorders of varying severity in 2017. This kind of data brings in a very shocking revelation of the number of new cases coming up in Indian population, and mental illness therefore needs to be looked at very seriously from various angles, for example, prevention techniques, drafting of policies, etc. Comorbidity gives us the information of the presence of more than one disorder in the same person. It could be one or more than one. The key components of comorbidity is that it is typically high with people who suffer from severe form of mental disorders. For example, bipolar disorders, it could be severe levels of depression. In another study that was conducted at NIMHANS by Dr. Shrivastava, he said that opiate dependence had a comorbidity of mood disorders that was about 35%, sexual dysfunctions were about 23%, psychotic disorders were about 11.5%, and anxiety disorders was 3.5%. They also found that with alcohol dependency, comorbidity of personality disorder was seen 30.8%. This kind of information helps the clinician with the treatment program. We now move on to the next part of the presentation, and that is we are going to look at treatment, an overview of treatment. Treatment of psychological disorders involves medication and different forms of psychotherapy. To understand treatment, it is important to understand why people seek help, why people come for treatment, and what is the nature of seeking treatment. The first reason people look to come for treatment is to deal with stressful life circumstances. For example, at the moment, there is COVID happening, there is pandemic happening, and the increase of stress is very high. And so, in such cases, people will seek treatment to help them deal with the stress situations. Sometimes it could be to deal with long-standing problems that are getting worse. For example, people with addiction problems could began with 1 drink a day, could go on to 2 drinks a day, and before the person knows it, can't live without alcohol and needs to look for treatment. Then you have reluctant clients who receive treatment through referrals. Reluctant clients are those who do not want to seek treatment, but because they end up in some kind of problems, they have referred for treatment. For example, the classic is juvenile delinquents or people who are youngsters who are caught bunking class, have to visit their counselor when the case is happening often. And finally, people seek treatment for personal growth, that is to understand themselves. Treatment can happen either hospitalization or outpatient treatment. For inpatient treatment, the mental health professional involved are clinical psychologists. Clinical psychologists are individuals who have completed their masters and trained in psychotherapy. Their main specialization is diagnosis and psychotherapy, and they use different types of psychological tools for diagnosis. Psychiatrists are individuals who have completed their MBBS and specialized in psychiatry. They prescribe medication. They also can be trained in psychotherapy and involve it in their treatment. Psychiatric nurses go through a nursing school, and their specialization is psychiatric care, where they help with hospital environment. Psychiatric social workers have to do their MSW with specialization in psychiatric care, and basically they work with involves dealing with family and society related problems. For example, if there is family dysfunctionality, dealing with that, or if the person has lost their job, or there is discrimination and prejudice against the individual because of his mental health condition. Mental health professionals are there for outpatient treatment. Basically, they are psychiatrists. So when somebody is feeling stressed up, depressed, they will visit a psychiatrist, or it could be a clinical psychologist who helps with the diagnosis again and does psychotherapy of some form. Could be psychoanalysis, could be behaviorism, depending on what is the nature of the problem. So, giving an understanding of these factors in the overview of abnormal psychology, I would like to leave you with a few questions for contemplation. What are your thoughts on mental health in Goa and India? What challenges do you think we face in these areas? Do people have access for treatment? And why is depression the most common form of diagnosis? Having contemplated on these questions, you will get a better understanding on this aspect. Thank you. The references follow: Saracen and Carson Boucher. Please refer to the journals which I've given, NIMHANS and the Lancet Journal, for the studies that were conducted on epidemiology surveys.